Now and hello and welcome to the Lobster Pot podcast, or is it just day 2 of Product Earth? We can't be sure, or maybe it's both. But regardless, we have our next seminar that didn't happen on the Sunday. We have Councillor Andrew Walters. Good to meet you, sir. How are things with you today? And where are you based?
Very well, Dave. Great to speak to you. I'm based in Salford, in Greater Manchester, so the northern side of the country.
Excellent, cool. And tell us a little bit about the work you do and what the topic's going to be a little bit about. Well, we can kind of see from the screen here.
Yeah, you can kind of get a clue from the slide. I've been involved in cannabis and psychedelic advocacy for the past 20 years or so. So I've been in the field for a long time. And since getting involved in politics, since 2021, I've used that as a sort of opportunity to be able to push the agenda and push the advocacy in sort of a different way. Because I've got access to sort of the political framework, I can use that mechanism in order to get the message across. So as an example, in November 2023, I'm forgetting where we are here, I moved a motion in full council for all council facilities to have cannabis consumption rooms for medicinal cannabis patients. So, and that was debated multiple occasions, November, January, March. We finally got it through, where are we up to now, in July. So it took about 9 months to get through. It was agreed on by the vast majority of the House. Labour group agreed with the motion, as did the Liberal Democrats. The Tories voted against it, surprise, surprise. But it was approved, although slightly modified. So what that means, and it's really precedent making, because it means that the council now has got, whenever they do an equality impact assessment, which they're required to do on any major project, they've got to consider how that will affect medicinal cannabis patients. So if they're opening up a new sports centre, for example, they've got to do a quality impact assessment. And as part of that, it's just dealing with those with disabilities. Do we have a safe space for cannabis users, medicinal cannabis users? And they've got to provide that. In current council facilities, now the situation is they're writing internal guidelines so that any employee, any member of the public, any elected member, anyone using council facilities has got to be provided with that safe space, which can't be with tobacco smokers. So it can't be outside if the weather's not appropriate. So it's really precedent making. I've been contacted by people all over the country who want to replicate that in other councils. And I think this is a really important thing because obviously we've got the pressure on central government to change the law, get more NHS prescriptions and so on. And there are great people doing a lot of advocacy there. But here we're going sort of bottom up, grassroots advocacy on a local level. And once we spread that across, we can actually really get that message across and reduce the stigma.
Very, very cool. Now, like you say, setting a precedent is what we need to do and show, well, actually, if it works in one area, it's bound to work somewhere else. But again, tell us a little bit more and let's get into the presentation and we'll take it from there.
Yeah, so I mean, this presentation, what I want to talk about is actually the Equality Act and the public sector duty, as you can see on the screen. The public sector duty is part of the Equality Act. They are slightly different in that the Equality Act applies to any commercial business, any housing provider, and anyone not necessarily in the public sector. So a restaurant, a retail shop, place of work, anyone in any kind of housing with landlords, that would apply there. And the public sector duty is sort of an extension of that with even more requirements for those in the public sector. So that would apply to government buildings, libraries, anything like that. So do you want me to start going through the presentation now? Okay, so I'm going to run through this here if I can get the IT working. I've got a brief agenda here. We'll go through what exactly the Equality Act is and how it applies to medicinal cannabis, and then we'll go through public sector equality duty. So first of all, what is the Equality Act? Where does it apply? It applies throughout the United Kingdom with the exception of Northern Ireland. So a lot of this will not apply to Northern Ireland. They're still stuck on previous legislation, which I'm not covering here. But this does apply to England, Scotland, and Wales. So it doesn't apply in a private house, a private property. So if you're going to your friend's house and you say, can I vape in here? And he says no, There's nothing you can do about it. No one's got any requirement to allow you to use your cannabis in their product. But let's say you go into any kind of a shop or a store. So part 3, as you can see on the left-hand side, anyone who provides goods or facilities to the public, they've got to, they're covered by the Equality Act. Landlords covered by part 4, employment part 5, education part 6, and then we've got associations part 7. And we'll deal with the part 11 in the bottom later. That's the public sector duty. So anywhere that you're in any sort of commercial environment, as it were, the Equality Act will apply. And we'll see exactly how it applies here. It applies to any kind of discrimination, direct or indirect, for any of the protected characteristics. And the main protected characteristic which is relevant here is disability. Yeah, because that's the one that's going to be relevant to the medicinal cannabis users. And the Equality Act, I'm not going to read through it, but it applies anyone. The definition of a disability is any physical or mental impairment, and that impairment's got a substantial long-term effect on normal day-to-day activities. And prohibited conduct is treating them unfavorably. If A treats B unfavorably because of something arising in consequences of the disability, and that can't be shown to be proportionate. So we'll talk about proportionality soon, but just as an example, if there's sort of an old building around since the 1800s, listed building, and they can't physically fit a lift in there, that could be disproportionate. So there are exceptions to the Equality Act. It's not 100% you can do it because you are disabled. There are certain cases where the local authority or the public body or the commercial entity can show it's disproportionate, but the burden is on them to prove it's disproportionate. The disabled user doesn't need to prove it. The burden is on them. So we talk about equality, and inequality. There's several sort of definitions of equality. Equality doesn't necessarily mean everyone having the same thing, like in the technical definition of equality. What we're really talking in this sense is more equity, which means that some people may be given things that other people are not given in order for them to both be able to reach the same place. So a non-medical user would not be entitled to say, well, I want to vape cannabis as well. It's not fair. May be fair, may not be fair, but you don't need to give everyone the same tools. You need to give everyone the tools to reach that same place, which is that avoidance of disability to the extent that it's possible. And there's a statutory code of practice, statutory in the sense that it's not optional, it's absolutely required and by all who are covered. And it's really important to know it's never unlawful to treat a disabled person more favorably than a non-disabled person. So it's perfectly acceptable for them to say medicinal patients can use their cannabis, other patients can't. And again, what is the definition of unfavorably? It's a disadvantage. So if somebody, for example, can't use the library because they've got a disability and they're requiring them to vape cannabis in order to relieve that, they may have something like agoraphobia. They're scared to leave the house, but the cannabis relieves that. So if they're unable to use the facilities because of their agoraphobia and cannabis could relieve that, that could be considered an unfavorable treatment. So let's look at what the conditions it can be prescribed for. There's actually no set of conditions under UK law. It's a doctor's discretion, but the common things I've listed up here in the slide. And again, we've got the main ones: the chronic pain, psychiatric conditions, neurological conditions, and various other bits and pieces. And most of these will fall under the definition of a statutory disability under the Act. So very important to know that the patients can use the medication in the way that's prescribed. So it's just because, for example, an oil may be available, which is, who says you need to vape, take an oil, but it's for the patient to decide in accordance with the doctor the most effective method of utilizing the cannabis. So if they're prescribed cannabis for vaping, then it will be discriminatory to say, well, you should use the oil instead. They've got different effects. The oil takes longer. It may be good for a sort of longer term effect through the day, but if they need that instant relief, then vaping is generally the only way. So it's important to know that vaping has to be allowed. Should be clear that smoking is currently not permitted under UK legislation. So there'd be there's no way of claiming that I need to smoke cannabis, and obviously the providers don't need to give that because it's technically not prescribed for that purpose. So we're talking about vaping using a dry herb vape or a or a sort of e-cigarette equivalent where they're sort of dissolved in VG or PG. So important to know that tandem mass spectrometry has shown there's no risk of second-hand inhalation for bystanders. Yeah, that's very important because the providers shouldn't be able to claim that they've got to consider the other users. The fact that somebody doesn't like the smell of it, well, not liking a smell is not covered by the Equalities Act. So therefore, no one can say, I do not like the smell of this, therefore it shouldn't be allowed. So therefore, there's no sort of argument to say that we need to protect other people. Yeah, scientific evidence, yeah, and again, we're going on evidence-based direction here, has shown that there's no risks of secondhand exposure, and therefore there's no legitimate claim of bystanders that they just don't like it. And unfortunately, we have seen housing associations, police forces, and others that have threatened eviction and arrested people for possession of medicinal cannabis. Again, I'm not going into the policing side or the driving side, despite the statutory exemption from the Road Traffic Act, Section 5A. There's a statutory exemption from that, as long as people are not impaired. But what is relevant is housing associations, and for that matter, private landlords, making a condition that no cannabis may be vaped in the property. And I personally dealt with cases of potential eviction for tenants who have been threatened with this. And again, we've shown that that would be a breach of the Equality Act. So till now, we've covered what applies to everyone who's covered by the Equality Act, which again, commercial and public sector. But the public sector has got an even bigger responsibility. And
quite impressed by that picture back there. Someone looking like Michael Goves on the puffing on a. Sorry, I'll let you carry on.
Oh, go on. Yes, yes. The public sector has not just got a passive responsibility to avoid discrimination. They've actually got an active responsibility. So they've got to have due regard to the need to eliminate that discrimination, advance equality, and again foster good relations with people who have got that. So local authorities have got to actually work on proactively providing those facilities, even if they're not asked for necessarily, because somebody shouldn't need to have to beg for the facilities to make their life normal. So what does that mean? As mentioned, we've got the Equalities Impact Assessment, which is a public sector duty to, and again, there's quite a lot of controversy over the winter fuel allowance, whether the government did or didn't do an Equalities Impact Assessment. And I believe there's a legal challenge, potentially judicial review on that particular matter. That's just an example. And we'll obviously watch this space, see what's going to happen with that. But it means that the public sector, before they make any decision whatsoever, have got to proactively consider what will happen to users covered by the Equality Act. And that includes medicinal cannabis users, the majority of which are covered by the legislation. So what are their responsibilities? So we've said they've got to actually proactively eliminate unlawful discrimination. They've got to advance equality of opportunity. So it may be, staff policies, for example, to ensure that cannabis users are able to take breaks if they need to go and vape, if they don't want to do it at their desks, which is fair enough, because some may not be comfortable doing it in public, just like somebody may not be comfortable injecting themselves with insulin in public. And also fostering good relations. This is quite vague what exactly it means. But and again, the legislation is quite clear that they've got to it's their responsibility as a public sector to proactively work on fostering those good relations. And then there's the compliance and monitoring. They've got to retroactively see what they've done and ensure that they've done what they need to do in order to monitor that. And again, whilst it shouldn't have been necessary, the motion that I put through Salford Council made this explicit that it's part of every future equality impact assessment. But the Equalities Act de jure puts it into everyone anyway. The authorities may not be aware of that. So how do we eliminate unlawful discrimination? We've got to make sure the policies, workplace policies, are suitable. Obviously, there will be some exceptions. So if somebody is a driver of a heavy goods vehicle and they are impaired by the use of cannabis, and not everyone is, but some people may be. Some people may not feel safe to drive for a certain period of time after using cannabis. So there it would be acceptable for the authority to say, well, you can't drive this rubbish truck after using cannabis because you're impaired. That's fine. They're allowed to do that, but they need to make sure their policies are maybe giving them a desk position or giving them different hours in order for them to do that. And again, service users. That means anyone using the facilities, going to the library, going to the town hall, using any other facilities offered by a local authority or central government in order to access those provisions. Going to a gym, a lot of gyms are owned by local authorities. So these things are things that they need to eliminate unlawful discrimination. And again, how do we advance equality of opportunity? So training and education is obviously the key one. So that's a fantastic thing we can get done. And again, by offering this, I actually gave a very similar presentation to the Public Policy Exchange, which is attended by various local authorities, police, housing associations, and so on. And I think that's part of the education, but further education as to what is allowed, how it's allowed, what it's used for. And again, information accessibility. So things like having signs up saying you can use cannabis here. Medicinal cannabis users can use it here. Yeah, it doesn't need to be everywhere. Again, they don't need to allow you to use it in the whole library, for example, but they need to provide maybe a side room or similar, depending on the situation. Now, how do we do fostering good relations? Again, a requirement. So public awareness campaigns are one example, removing stigma, and again, community engagement, discussing with patients and officers and elected members and so on to ensure their needs and perspectives are considered. And I think we mentioned this earlier, policy development, equality impact assessments to make sure that no policy going forwards or even backwards disadvantage medicinal cannabis users. And I think we've also already mentioned employment practices to ensure that users have got access to facilities as appropriate. And then the last one is they've got the compliance and monitoring. The authorities have got to review the published data. They've got to see how the policies affect those and set those objectives to improve those as necessary. So that's where we're up to now. Till now, everything is pretty much almost explicit in the Act, and there's a responsibility as appropriate on all subject to the Equality Act, and for public sector bodies even more. Now, how do we go forwards? We've got recommendations for improvements. I've covered a lot of these. I'm not going to read through them, but again, updating the policies, training programs, public awareness campaigns, lots. And again, we've got collaborative forums and legislative advocacy. So that means the public authorities themselves could be advocating to the NHS trusts as appropriate to get these prescriptions for those who can't afford them. And what's going to happen next? So we've got to look across the Atlantic to see what's happened in the US, because the US is at least 10, maybe 20 years ahead of us. So why reinvent the wheel? Some suggestions of how the UK can improve is by looking at how they've done things stateside. So one example is California, where they've introduced AB 2188, which protects employees off duty site and ensures that public sector employees don't discriminate against employees or applicants based on their legal use outside of work. That's one option. We've got, what's going on here? Training in California, same legislation. They've got to be regularly trained. We've got other states like Colorado and Washington that they've got monitoring systems, as we discussed, as a requirement to collect that data and ensure, for example, law enforcement outcomes. Do we have that data to ensure the police are doing the right thing? Oregon and Nevada have got facilities, libraries, and parks which have been adapted for medicinal patients and with clear guidance. That's another suggestion. Colorado, we've got public education campaigns. Massachusetts, we've got working together. Again, these are all things that we've discussed are required under the Equality Act, the UK legislation, but this is how it's actually been done in practice in the US and will be a good model to copy. And we've mentioned advocacy efforts, which we've got in New York and New Jersey. We've got patient service in Arizona. And these are all suggestions on how we can improve. So what we've got to be very clear on is, well, I like this quote, the most dangerous thing about cannabis is getting caught with it. And we're hoping that at least in the medicinal side, this can be completely removed, because especially with people who have been things with anxiety, depression, PTSD, getting stopped by the police, potentially arrested, even if de-arrested later. And obviously they will get thrown out by the magistrates, but the stress of having to go through that court process is itself extremely worrying. And that brings us to the end. At this point, Dave, I see you've been carefully taking notes, and I'm sure you've got lots of questions. So go ahead, fire away.
No, Andrew, it's fascinating. I think, again, the first thing, there's a couple of things that sort of immediately come to mind, but I suppose the first sort of thing I was thinking around, again, when you think about, talking about workplace policies and things like that, I mean, what is the likelihood, I guess, that we will start to see these sorts of, medical cannabis provision being made in workplaces and public sector areas as well? Because it strikes me that, for example, could therefore, we talk about the discrimination aspect of this, some, schools would therefore need to provide provision for medical cannabis users. So that essentially means that people could be taking the medical cannabis actually within schools themselves. Whereas I know that feels a big contrast from a lot of the kind of recreational stuff, particularly in the US, where they make provision to actually, you've got to be this many meters away from school buildings. And again, I know it's two kind of different things, but when you think about it being the same product or the same flower plant, it's there's quite a lot wrapped up in that. But again, what's your kind of thoughts around this is what we need to do? How soon will it happen? And what do we need to take into consideration, particularly around, public health and young people and, those sort of perceptions?
It's a great question, Dave. So right now we're working through this legal fiction, this binary cannabis of medicinal versus recreational.
Yeah.
It's a load of nonsense, because it's a lot of people who use it so-called recreationally are doing it medicinally, but they may not even realize it themselves. They're self-medicating. If somebody has a glass of wine to relax in the evening, is that recreational or is that medicinal? If somebody vapes a bit of cannabis because they're under a lot of stress, is that medicinal or recreational? So sorry about that. So but we have to go with this sort of legal fiction in order we're dividing it into medicinal and recreational. As such, there's no real difference between a child that needs to be injected or inject themselves with insulin or a recreational heroin user who injects himself with heroin. Yeah, they're completely and utterly separate, and therefore the fact that we've got problems with recreational use around schools in the US or otherwise should be completely and utterly irrelevant to this case. And that's sort of the message we have to get across, that it's not the same as recreational use. And again, it's a false narrative in a certain sense, but we've got to be very careful not to allow the authorities to think of medicinal cannabis as a slippery slope to legalizing recreational cannabis. And recreational cannabis will be and should be legal at some point. I don't know when. Depends on the government, depends on public opinion. But
finger in the air kind of thing, isn't it? But no, I think
it's a finger in the air. But at this point, we've got to go very much with it's medicinal. It's got nothing to do with recreational. Schools have got to provide facilities for it. It doesn't mean that the children have got to be allowed to walk around with it and vape wherever they want to. Normally in such case, just like with any other medication, children aren't allowed to carry their own medication. Any medication's got to be handed into the school nurse or the school office, and they come as required to take that medication. I don't see it should be any different whatsoever with medicinal cannabis. And that's really what the case is. And again, you're asking, when is it going to change? It's already changed with the Equality Act. The law is in place. We don't need anything else at this point. We just need to get that awareness across. Practically speaking, when it's going to happen when there's a legal challenge. When a child or a teacher or whoever it is claims that they need to use the medication, the school refuses, and it goes to court. That's the way it will happen. Hopefully, it won't necessarily get that far. Hopefully, it'll be resolved before that. You asked about workplaces and other places. A lot of, for example, amusement parks lately have been challenged on this. For example, they may have a no smoking, no vaping policy, but on being challenged, a lot of them have agreed to allow specific places for people to vape their medicinal cannabis. I'm not going to mention any particular names, but I think they're fairly easy to find by Googling or looking on Reddit boards. But some have events, such as public park life events and those sorts of things. Sometimes they've refused, sometimes they've allowed it, but in every single case, when it's been challenged, they've given in. So don't be scared. That's the message. If you're a medicinal user, you're qualified by the Quality Act, stand up for your rights, challenge it appropriately. But there's one key message. Don't be the sort of person that gives a bad name for medicinal cannabis patients. Don't be a wise guy. Don't be rude. Don't be aggressive. Don't try and annoy people to prove a point, because that's counterproductive. Yeah, just because you can use it and right in the middle doesn't mean you have to. There's nothing stopping, it's a two-way street. And if medicinal cannabis users also need to sort of go to the extent of being decent to other people. So if it bothers other people, yeah, you could stand on your rights and say, yeah, I'm legally allowed to use it right here. But why should you? If you can be discreet, then be discreet. And some people would argue with me and say, no, you've got to stick up for yourself and stand up for yourself. I think if people are nice to each other, I think it works better for everyone.
Right. It's really a case of we have to be mindful of each other as much as we need to be mindful of people's needs to take, medication. And, and again, I would argue that is just as important from the patient's perspective, to be like, well, I don't need to be standing outside the school waiting to collect my kids with a vape in my hand, sort of blowing cannabis smoke everywhere. Why couldn't I have done that 10 minutes before I go? Sort of thing. It's it's a two-way street, and it's about kind of balancing what people perception versus what you need to do. And I think again it's harder to kind of put in place from a kind of legal perspective, but if the basis is there through the Equality Act and things like that you should have the right to do this, then I feel like if people feel empowered to be able to do things, then they have a greater agency to kind of do what they feel is more appropriate. They don't have to sort of say, well, no one said I can't type thing, unless again, it's this is the things we're dealing with, and it's not as you mentioned, as binary as we like to think of it in some respects.
No, but again, it's an emerging field. As we learn more about it and people get more aware, the stigma will fade, and we'll get there. But again, just because you can doesn't mean you should. The Equality Act protects the patients. There's nothing protecting the other people, so therefore, just be a decent human being, be nice, and it will be good for everyone.
Absolutely, and that's a good message to end it on. But no, thank you so much, Andrew. I really appreciate your insights, and we got there how to contact you if people have got questions. So no, but thank you so much, and look forward to speaking again soon.
Great, Dave. Thank you. Pleasure. Thank you for having me on the show. All the best.
No problem. Bye bye.